Welcome to the University of Kentucky Medical Center Library's drug searching video series. Today's video is part 2 of our look at LexiDrug. We're going to start by reminding you how to find the age indices in LexiDrug, which we covered briefly in part 1, and then we're going to break down the LexiDrug records in all the different age-related indices. As a reminder, you can access this resource either via a mobile app or a desktop version, and we will be searching the desktop version. So let's start searching LexiDrug. If I use this main search bar and start typing in a drug name, in this case amoxicillin, you'll see it'll start auto-populating the drug names, and I will select the one I want. And it'll immediately take me to this list of indices or indexes that are available within LexiDrug. The largest and most comprehensive and therefore broadest database is LexiDrug's itself, which is what the database is named for. Its primary focus is dosing, administration, and adverse reactions. But if I click into here, you can also see that it covers everything from brand names, warnings and precautions, reproduction, pregnancy, lactation, and a whole bunch of other things, including, even in this case, dental information. And one thing I did want to point out is that it does even have a section for clinical practice guidelines that you can click on and get the full link to the relevant clinical practice guidelines related to this drug. And if I was to go into any of these sections, I would find these little sections in parentheses that say ref. If I click on them, it would take me to the articles where this information comes from. Because as a reminder, LexiDrug and all the databases in it are point-of-care tools, which means they're meant to be summary information that is meant to be used in a clinical setting. You're not getting primary literature here as you would in PubMed. You're not getting full articles. Therefore, you're getting these small summaries, these quick little bites that are meant to be easily digested, but it should be always pointing you towards where the information came from, which you can get via a link and read yourself to get the full story of where this is coming from. Along the top, there's also a section for drug identification images, as well as adult patient education and pediatric patient education. If I go back to the main Monograph section, and I go into dosages, I do want to point out that there are a whole range of ages here. So there is adult, older adult, or geriatric, as well as adults with various complications, and a few pediatric sections. And under the pediatrics, there is some limited infant information as well. However, I would still always lean on the side of considering LexiDrugs to be primarily an adult drug database. If you are dealing with a pediatric or neonatal patient or a geriatric patient, I think it's important to take the time and actually use the pediatric neonatal LexiDrugs database, or if you scroll down a little further, the geriatric LexiDrugs database. The pediatrics database is advertised as specifically containing more detailed dosing recommendations that have been researched and compiled by pediatric specialists, and it is particularly detailed in neonatal and pediatric dosing. Comparatively, the geriatric database is more focused on hepatic, kidney and liver impairments in older adults. So I do suggest that you always make sure to use these databases should you have a patient that falls into these population groups. And if I go into the pediatric and neonatal group, you can immediately see that the dosing is broken down much more specifically into neonatal, pediatric, and adults, and it does have more specific dosing regimens. And it also has its own clinical practice guidelines specifically for the pediatric population. And should you need to go back to it from within the pediatric guide or the geriatric guide, you can go right back to LexiDrug's, the main adult general index as well. Thank you so much for watching this presentation. If you need assistance from the Medical Center Library, please contact us via email at mclib@uky.edu. That's mclib@uky.edu.